Hi, good morning. I'm Dr. Ahsen Nazir, and I'm going to talk about the breast awareness program with you. The breast disease is very common worldwide, especially in Pakistan. The diagnosis is done very late. There can be benign diseases, there can be malignant disease, which is called as cancer. The incidence of cancer is on the rise worldwide, also in Pakistan. When we talk about cancer, we talk about staging of the disease. It can be early cancer, it can be late cancer. Due to the social taboos and modesty of our population, when we see patients coming to us, it's usually the late stage. The tragedy is that the 5 year survival after the treatment can be modified if we detect, or if we are able to identify the breast cancer or the disease burden in the early stages. That makes a lot of difference. So we're going to do the breast awareness program, and the first component of the program is a breast self-examination. We can teach the females to examine the breast every month. If they find any change, any alteration, anything alarming, they can come to the doctor. Not necessarily to me, but to any doctor. Then we have a screening program which is ultrasonography of the breast, maybe once a year or 6 monthly, or a mammography. In the early age, up to 35 to 40, we do not go for mammography, but we advise ultrasonography of the breast. And in the later stages, later age, you can go for a mammography. The mammography is a screening program, and if it is done yearly, the mammography is a screening program, and if it is done every year after the age of 40, it usually helps in detecting or identifying those groups of cancer patients which have very early breast cancer or the start of the breast cancer. Treatment is easy, less costly, and the survival or the cure is almost 100%. So it is very important. This is a message I want to give you. Not that because I am a surgeon, I want to operate. Once in Royal College of Surgeons of Glasgow, I met the president of the Royal College of Surgeons of Glasgow, and he said, "You know what to operate in 5 years, and then you know what not to operate in 20 years. You are a surgeon when you are a reluctant warrior. When you do not want to operate, or you know when not to operate, you are a surgeon." We have programs. The pink ribbon is the international sign of breast awareness program for breast disease. We have a breast day, pink awareness day, or pink ribbon day. We celebrate every year, but that is not important. Every year is a pink, every day in a year is a pink ribbon day. We must emphasize this point. Whenever we find anything alarming, we must go to the doctor. Modesty is good, but then not at the cost of a life. Once we have a disease, we have a triple assessment. We go for history examination, maybe ultrasonography or mammography. Then we go for a needle biopsy or a pore biopsy. That is important. Once we go through the triple assessment, we are able to identify what kind of disease, what type of disease, what extent of disease, what stage of disease the patient has. This is very important. Once you go to the doctor, you must ask the doctor to make you go through the triple assessment. This is both for the benign as well as the malignant disease. The question is, how do you know that you have a breast disease? There are basically three symptoms. There can be pain in one or both breasts. There can be any kind of a discharge, liquid coming out, which can be any color, yellow, green, white, or red. or maybe mixed yellow and red, which is called as sentinels. And the third is a lump, any swelling. If you have these three symptoms, it is mandatory. We must consult a doctor, preferably a surgeon, but if not a surgeon, any of the doctors. We have been conducting the breast clinic for over 1.5 decades, both here in Pakistan and abroad. And it is alarming that the number of disease which is identified now is much more. But the good news is, if it is diagnosed at an early stage, detected at an early stage, the good news is that if it is identified at an early stage, the life quality and the quantity both are preserved. My message here will be that whenever you have these three symptoms, pain, any liquid coming out, discharge, or lump, you must go to the doctor, any of the doctors. Consult. Choice is yours, but you must go to a doctor. Hi, I'm Dr. Ahsen Nazir Ahmed. I am a surgeon by profession, and this is my website. And I'm going to give you a message today. This is about the breast awareness program. What I will emphasize today will be on the symptoms of breast disease, which, if anyone has, he or she, remember he or she, the breast disease can occur both in males as well as females. He or she must go to a doctor, consult a doctor or surgeon, any qualified physician who must advise her where to go, what to do. The three symptoms of breast disease which make you go to a doctor or which must alarm you, which must warn you that you are in danger are: number one, any pain in one or both breasts, any swelling or lump detected accidentally or otherwise. And number three is a discharge, anything coming out of breast. It can be any discharge, any color. It can be white, it can be yellow, it can be red, or it can be green, sometimes brown. But when you have these three symptoms, you must go to a doctor. You must ask any of your friends who is a doctor to examine the breast. If you are a male, that is more the important, because in males the breast disease spreads like wildfire very rapidly because they have less fat. So it is very important. My today's message is that when you have these three symptoms in the breast, pain, discharge or something coming out like a liquid, or you have a lump, you must go to a doctor. Good luck. Hello there, I'm Dr. Ahsen Nazir Ahmed. We have talked a lot about breast awareness, and we will be talking about breast awareness programs, screening, symptoms of breast disease, you, the patient, or we, the patient, going to the doctor for the treatment, for the assessment, for consultation. But one thing I would like to emphasize here is that once you have a breast disease, once you have a cancer or a malignancy, how to go about it. We running the breast clinic for the last 15 years, and the world all over in the civilized centers is doing a sentinel lymph node biopsy. Once you have a cancer or a malignancy in the breast, and especially if it is the advanced stage, you have to remove the breast and clear the axilla or the armpit of the nodes. But this is an important concept, when you are going to remove the breast or the lump or the swelling in the breast, you do not always need to clear the entire axilla or the armpit. What we do is a sentinel lymph node biopsy. We inject a dye in the tumor or the swelling, and we take out with a small incision the first lymph node or the filter in the armpit or the axilla, which receives this dye. But this concept is very important. Once we remove one lymph node, we subject it, we give it to the pathologist to do the histopathology to see whether this lymph node or filter has malignancy in it or not. If it doesn't have a malignancy, remember this lymph node is receiving the lymph or the fluid from the tumor. And if this lymph node does not have the malignancy in it, is the first lymph node called as sentinel lymph node, then there is no need to clear the armpit or the axilla by the operation. This is of extreme importance. Lot of surgeries, lot of major surgeries, lot of disability can be prevented by practicing this practice of sentinel lymph node biopsy. We are doing it. Many people are doing it. So when you have a malignancy, remember, ask your doctor, ask your surgeon, is it possible to do a sentinel lymph node biopsy? This is your right. For me, patients have all the rights. We as doctors do not have rights, but the patients have all the rights. They must be counseled, they must be told what is right, what is wrong, what is the right practice, what are the studies, and according to that they make the choice. But we help them to make the right choice. And this is the message for today. Thank you very much.